The failure of reactive medicine. For centuries, cardiology has been fundamentally reactive. We wait for symptoms like chest pain or an irregular pulse before we intervene, which is often too late. By the time a doctor puts a stethoscope to your chest, the damage might already be irreversible, turning healthcare into damage control rather than prevention. At Zero Fat TV Think Different, we believe the future lies in seeing the invisible before it becomes a crisis. We are moving away from relying solely on biological signals like your pulse and blood pressure, shifting instead toward a revolution where massive data sets predict your heart's future long before you feel a single flutter.
The rise of the digital twin. Imagine a perfect beating replica of your heart living entirely inside a computer, simulating your specific blood flow, arterial stiffness, and genetic risks 24/7. This technology is called a digital twin, and it allows doctors to test surgeries, medications, and lifestyle changes on your virtual heart before ever touching your real one. Instead of generic advice, physicians can now run thousands of simulations to see exactly how your unique physiology will react to a specific beta blocker or a new exercise regimen. This isn't science fiction. Major hospitals are already using patient-specific computational models to visualize blockages that traditional angiograms might miss. Data is the new stethoscope. The tools of the trade are changing rapidly. The stethoscope is being overshadowed by algorithms that crave raw data from wearables, genomic sequencing, and historical health records. Your Apple Watch or Fitbit isn't just counting steps. It is collecting long-term variability data that, when fed into AI models, can detect atrial fibrillation or impending heart failure weeks in advance. Doctors want this data because a pulse check is just a snapshot of a single moment, whereas your data history is a high-definition movie of your overall health. By analyzing these vast data lakes, AI can spot subtle patterns of deterioration that no human doctor could ever perceive during a 15-minute annual checkup. Predicting the unpredictable. The ultimate goal of this data revolution is to make the sudden heart attack a thing of the past by turning cardiology into a predictive science. Currently, a massive percentage of heart attacks occur in people who looked fine on paper because standard tests failed to capture the complex interplay of their specific risk factors. With computational medicine, we can calculate the shear stress on specific artery walls to predict exactly where plaque will rupture and cause a clot. This shift means we can treat the patient for a heart attack they were scheduled to have 5 years from now, effectively canceling the event before it happens. The ethical and privacy frontier. However, this brave new world of data-driven immortality comes with significant questions about privacy, ownership, and the security of our most intimate biological information. If a digital copy of your heart exists in the cloud, who owns it? And could insurance companies use that data to deny you coverage based on a prediction of future illness? As we hand over our biometric data to tech giants and hospital systems, we must demand robust encryption and ethical guidelines to ensure this technology serves patients, not profits. The end of heart attacks is within reach, but we must ensure that in the process of saving our hearts, we don't lose control of our digital selves.
The era of reactive cardiology is ending as doctors shift focus from simple biological signals, like pulses, to complex predictive data models known as digital twins. This technology allows for virtual simulations of treatments and utilizes AI to analyze wearable data, predicting heart failures and blockages long before symptoms appear. While this promises to eradicate the sudden heart attack by treating future risks today, it raises critical concerns regarding data privacy and the ownership of our biological information. Ultimately, data is becoming the most potent drug in medicine, offering a future where heart attacks are not treated, but deleted. Thanks for watching. Zero Fat TV, think different.
Subscribe. Like.
Better things are coming. Rich Hamilton.